Okay, hello everyone, and welcome to the second session in our HSITAG Interoperability webinar series. Today we are going to be talking about blended by design, funding interoperability with flexibility and purpose. So since fun is in the title, obviously this will be a fun event today. I'm Carol Hussey, and I'm thrilled to be with you today as your moderator for this event. Just in terms of setting some context, in case you were not able to attend our previous, the first episode of this series, the Interoperability Today and Tomorrow series is a continuation of the HSITAG white paper, interoperability white paper that we published last year. And so our goal is really to take the ideas from the paper and then turn that into consumable chunks of content that would be of interest to specific individuals. So like data sharing and connected systems and funding and that sort of thing. So we're bringing them to life through these conversations with real people who are actually doing this work on the ground. So we've been talking about interoperability for a long, long time. There are always a lot of challenges when we do these sort of projects. And so we're going to explore today what it takes to move from concept to practice, bringing the vision to value and the conversations that we're having across the country to build cross-programmatic systems of care. So if you attended our last panel, last week, we offered more of a strategic view of the value of data interoperability, how it improves outcomes and reduces duplication, creates measurable impact, all of those things. Today, we're going to turn our conversation to funding. Obviously, we need funding to be able to do these projects, and it's sometimes hard to think about how that's constructed. So funding is often where interoperability either moves forward or it stops dead in its tracks. And we don't want that to happen. States and localities are constantly facing a myriad of challenges, with all of the funding constraints that we're currently having. And working within some of the cost allocation rules, stretching those dollars across programs, all while keeping up with some evolving federal guidance, right? We know we've got a lot of guidance coming out with HR 1, in particular of note recently, the SNAP program, right? And how we're going to track work requirements. Those work requirements aren't super straightforward. It's not one data source. So this is a great opportunity to talk about how agencies and partners can creatively finance interoperability and how to make the most of those existing investments that you have, leveraging and maximizing federal match opportunities and building sustainable funding models that can grow over time. So that's what we're going to talk about today. We have a fantastic panel of experts with us today, each bringing unique perspectives on funding and flexibility, and then the sustainability and impact that I mentioned. First on our panel today, we have Kathryn Vesey-White, who's the Director of Budget Process and Studies with the National Association of State Budget Officers, NASBO, as we often refer to them. And Kathryn works very closely with states across the country, improving budgeting processes and aligning fiscal planning with program priorities. Next up, we have Waldo Mikels-Carrasco. He's a principal consultant with the Otro project, and Waldo has led some groundbreaking work around the country with community-driven, equity-centered funding models. And that blends federal, state, and other local or private sector collaboration and funding models. So we'll talk a lot about that. And then a familiar face to many of you, I'm sure, is Ahluwalia, Director of LEAP Strategies. Many of you know her from her days in Montgomery County, Maryland, one of the national leaders in innovation during that time, especially. And so Uma's bringing that deep expertise as a former agency director today, and as a consultant, helping states to braid those funding streams and implement complex systems reforms. So first, thank you to all of our panel members for being here today. And with all of that, we'll dive in. I should also say that we are going to allow some time at the end for open questions and answers. So please do feel free to use the Q&A button at the bottom of your screen to submit questions that you may have along the way, and then we'll catch up with them after we have our discussion. So thank you all for joining us, and we'll start with talking a little bit about breaking the silo mindset. Um, that's the easiest way to get the funding, right? It's typical program silos, one APD to one federal agency to one RFP. But when we talk about interoperability, it's not that simple, right? So let's start with Uma and talk about how you do that. How have you successfully navigated cost allocation, the rules around cost allocation, and blending those funding streams to support those cross-programmatic initiatives? You were one of the first in the nation that really focused on that. So if you could share about that experience, that'd be great.
Yeah. Excuse me. Hi, everyone. When, there is a difference between county and state in terms of what is feasible and what you can do, even with cost allocation planning. A lot of our cost allocation plan fed through the state, but we did have the human services side and the Medicaid or the public health and healthcare eligibility side sort of go through a cost allocation process. At that was the time when we were doing it, when the three agency letter came out that said that Medicaid was going to fund 90% for trying to get eligibility folded in across SNAP, TANF, and Medicaid. And the state definitely, I was in Maryland, so MD Think was a big driver for the state of Maryland at that time. And so our project, trying to make the business case, a lot of time and effort went into making the business case. And what we ended up doing was actually clawing dollars that were there for maintenance of multiple data systems and trying to figure out if we could integrate it in this way. And we had at that time 126 data systems and databases, that different parts of the programs. We had 136 different programs in the county Department of Health and Human Services that were touching, and and you could not tell at that moment just looking at a client to see what services they were getting across the system. And so that to me is the most powerful use case you can make, right? Why would you want somebody to go touch 10 systems, tell their story again and again, like incredible trauma associated with that? And so we made the pitch to try to create a no wrong door single case management system. And I remember an IT, and I'll stop after this, an IT director saying to me, there are 5 components to every system. You have screening, you have intake, you have assessment, you have case management, and then you have follow-up, case planning and case management, and then you have follow-up on service delivery. Well, if you look at those 5 components of an IT system, they pretty much replicate themselves across multiple systems. And so that was part of the use case that we made. And we did submit, the administrative side of cost allocation planning to pull the data system into it. Did both the health department and the Department of Human Services buy into our value proposition at the state? I'm not sure they did. It was a continuous work in progress, but we were able to persuade our county council and our county executive, who really bought into this value that residents in the county shouldn't experience so many different touch points with the system. And so we kept marching forward, but it was the admin side that we were able to leverage, not so much the programmatic side of the house. So long
Yeah.
answer, sorry.
No, no, that's okay. That's great. I think it's indicative of a lot of the challenges that many other organizations face as well in terms of, assuming that things are the same from one program to another is sometimes challenging, right? Case management in child welfare is not case management in Medicaid, right? It's different. So there's a lot of unique things that do happen, and I think people do get concerned about that. So am I going to lose some of that autonomy and the tailored aspects that go with what I do versus what happens in a different program area. Waldo, you have worked across a wide variety of stakeholders. Can you talk a little bit about your experience in breaking down that silo mindset?
Yeah, and I'll say that Uma's example from Maryland, it resonates across a lot of the public health infrastructure data monetization work that we consulted on providing technical assistance to. Um, and the idea within government allocation is not dissimilar to the idea in multi-sector data sharing across social, human services, community-based organizations, healthcare, and government, right? That it's an ecosystem that you need to consider the ecosystem that the data lives within. And to Uma's point, the same data types will touch multiple systems,
Mhm.
and be replicated in multiple systems, and people have to uh, collect that. Understanding, though, underneath what the workflows are that represent that data represents, or that those systems represent, is super important for all the stakeholders involved. And that's whether you're in multiple bureaus or administrations within state government or local government, or if you're dealing with stakeholders out in the community, healthcare organizations and community-based organizations who are working together collaboratively on use cases, and needing to share information in order to get the outcomes that they want. You have to understand what it is that each and this takes work, right? This is the idea of shared governance, which is difficult sometimes when you're dealing with federally allocated funding, but that you have to understand across those things, what is that CBO doing? What is that community-based organization doing? And are they, because they're the ones who are most directly engaging with those clients or patients, are they, what data are they collecting, and how are they collecting it? And how do we get that safely, securely into shared with these other data systems, so that it isn't it's you're seeing the efficiency in interoperability, right? We're not being interoperable just for the sake of it being interoperable, but because we're reducing costs, because we're reducing effort, and reducing the opportunities for transcription errors, and improving data quality, and improving the experience of the people who are doing the work, and the people that they're doing the work for, as Uma had said. So it's while there are different considerations when you're working more tied to the community, or with community partners or industry partners, the same rules hold true within just within state or county administrations. You have to understand what those workflows are, and why it makes sense to use a standard data type to just collect that information once, and be able to share it across these different workflows and these different systems that those workflows are supporting.
Mhm. Yeah, and when we were prepping, Waldo, you talked about the difference, right, between outputs and outcomes, and you just rattled off several, right? When we are helping, or when a state puts together their APD request to the feds to obtain funding for these cross-programmatic systems, you have to be able to identify the expected outcomes of that investment. We are seeing this by and large across the country, with APDs that have been in place for years being paused or canceled because there's not been evidence of improved outcomes. That doesn't mean they weren't there. Maybe they just weren't tracking them well, right? But whatever you're putting in that APD, you must be showing that you're saving some money, you're improving outcomes, you're increasing efficiency. And then what are the measures in which you are going to prove that post implementation? So let me shift to Kathryn for a minute. Kathryn, in terms of your budget background and how feds and states are funding these sort of things, what are you seeing relative to breaking that silo mindset?
Sure. So yeah, from my from where we sit as a national organization, I can speak to some trends that we're seeing in states that I think do really support the efforts to break down silos and foster a more efficient use of funding streams from different sources, federal and state. One trend that comes to my mind on this question is that we're seeing more states move towards a more centralized management of federal funds and grants. In so doing, states, and in part, this trend we were seeing even before the pandemic, but the pandemic experience certainly accelerated this trend of more states standing up dedicated offices, statewide offices to manage federal funds and federal grants. And what we have, heard is, and seen is that a big impetus of this, especially for states that are continuing to move towards that model in a more permanent way, is a desire to use funds as strategically as possible, being able to understand the bigger picture of state needs across different agencies when it comes to using federal funds. And so for efforts to promote interoperability, funding data infrastructure, for example, to support that aim, I think that more centralized approach to funding, to managing federal funds, is how some states are going about supporting that effort.
Yeah. Yeah, I mean, it's the wise way to go, right? Like, so if you can get 90% funding for one thing and maybe 60% funding for something else, and you've got large portions of the population that are being served by both programs, you're going to want to maximize what you can, where you can get the biggest match, obviously within regulatory requirements of that. Rev Max was quite a big thing years ago, and largely that was contained within silos, but now we're seeing it across the enterprise much more so than we used to. And also with governor's offices getting much more involved in that, the budget office at the governor's level looking at across the programs, how do we maximize that federal match? Because also there are a lot of constraints that come with some of these, federal funds, right? And so you have to pick and choose, where you're going to apply that. A great example of that many years ago, was when in child welfare, NIDED first came out, asking states to track, data on national youth in transition, and that was tied to Chafee funding. But it was really, really hard to track youth once they aged out of the system, and states really struggled with that. So some states said, I'm just not going to get that Chafee money, I guess. So there's often, gives and takes that you have to weigh when you're making these decisions about how to get that match to work for you. Uma, have you had experience in your past where you had to come up with creative ways, especially at the local level, right? Where you knew that, there's some flow down of funds, certainly, and also the strings that come with that. How would you navigate that at a local level?
I think braiding is a far more effective strategy than blending, because with braiding, you can actually show the funding pathway that's coming, and you can meet all the audit requirements that come with it. But having figured out, if we looked at eligibility, for example, when we were in the county, we had TANF, SNAP, and Medicaid eligibility for sure, but we also had LIHEAP and childcare eligibility that was happening sitting side by side, as well as eligibility for emergency assistance, right? Rental assistance. And so we decided we were going to merge those operations in a way that a person walking in the door could experience all of that eligibility in a coordinated way and seamlessly. And to do that, we had to cross-train people. And so you have your training dollars, you have the admin that comes with in each of the programs around workforce, right, for training, for infrastructure. And so figuring out how that was largely a back-end function. Staff didn't need to know,
Right.
the really complicated way in all of that happens, but you can leverage funding in that way. But I too was very wary of any kind of blending activity, because then you lose the identity of the fund source and the audits. And there was never a time in our department when we weren't having auditors sitting over there looking at one
Yeah.
program or another. So it is a caution, you've got to be very careful. So a large part of our pitch was directed more locally to the county executive and the county council to be able to say, this is the value proposition, this is what we can give you. We can offset county dollars through these federal fund sources or state fund sources in this way. And we could then add it to our cap to do the admin drawdown, right? The 50%, if those folks who were in those federal programs were doing those federal activities, so or state mandated activities. So that was kind of how we did it. Braiding is a very effective strategy, and honestly, even on the programmatic side, braiding is very effective. So we're largely talking about interoperable systems. But when you think about child welfare, children's behavioral health, and children with very complex needs, that is a braiding environment, right? There are things that get paid for in room and board. There are things that go to treatment. There are things that are paid for, through a block grant. There are just all these opportunities. And I will say, in this moment of fiscal restraints, if that's what we want to call it, you can't say, well, I'll take my marbles and go or sit in a corner and play by myself. Those marbles just aren't there. You've got to work together to meet the needs of the children and families and adults who are walking in our doors. So I think the imperative and the value proposition has never been more urgent than it is today to figure this out.
Yeah. Yeah, and I think too, based on some of the rejection letters and things that we've seen lately, the blending is insufficient, right? It's too ambiguous. They want details. They want to see we got to get much more finite in the tracking of the funds and reporting on that. So we're going to see, or at least we're already starting to see, a lot more oversight in those areas in terms of how those APDUs and other submissions are sent for approvals. But I also like what you were sharing about the local level, because of a lot of what's happening now. It's it's flowing downhill in that the locals are really going to have to figure out how to get a lot more creative, and those partnerships become a lot more imperative, right, to continue to deliver services. Waldo, tell us about your experience in terms of funding some of these efforts, interoperable efforts, and some of the drivers around that for you across the variety of stakeholders.
Sure. First off, I do want to, again, I'm just going to agree with everything Uma says all the time, but that the concept of braiding actually is more accountable than blending programmatically, but it also, I think from an implementation perspective, it's easier to understand what you're doing and what you're not doing, and what's being allocated from a technology and data perspective to which program and who's responsible for that, and what you get to measure off of it. And I think a really good example of that is when you're looking at something like shared services, where the investment that you're making from this percentage of dollars from this program and this percentage of dollars from this program is to a common system that does 90% of what this program needs and 90% of what this program needs. But the overlap in there is that, again, that efficiency and the reduction of cost of standing up two siloed systems from each other, right? And that data is interoperable between them. So it checks every single box there. And from a programmatic perspective, it's like looking at things like maternal health and infant mortality, working alongside electronic case reporting, working alongside substance abuse programming, right? That these all maybe share a common set of subpopulations that are maybe Medicaid eligible as well, and that there's commonalities there that can be shared with common data elements that probably have very similar or same data types that could work within shared systems. And again, you have to architect these things from the beginning. It's not an afterthought, right? You have to design programs and design APDs that show from the outset that you've had these discussions, that you're collecting information from partners who understand each other's workflows and are working towards these common outcomes, even though they're in different programs, right? And you're able to draw those lines of accountability. And this could even be extended again out into the community. It's harder, but for electronic case reporting, a lot of the social and for maternal health, a lot of those social factors are coming from social services in the community, right, or at the community-based level. So you need that information in order to really make electronic case reporting viable. So it's just another example of de-siloing that, but also describing it correctly from the outside in the design going into the APD of how you're going to get to those outcomes.
Yeah. And when we talk about design too, we're not talking about ripping and replacing every system you have. We're talking about designing how are we going to leverage the systems that we have, right, to work better together. That's the interoperable piece of that, so that people can be served more efficiently and still improve those outcomes. Kathryn, we jumped real quickly over to blending and braiding, so I'm going to go back a little bit to like the federal match rules and any sort of creative ways that you're seeing at the national level, how states and localities are one, leveraging the federal match opportunity, but also perhaps, looking at other creative funding strategies to advance their interoperability goals.
Sure. So yeah, I think on that question, and obviously this conversation has already talked a lot about data systems. So I'm just going to piggyback off of that and point to the number of states and localities that have leveraged federal funds, matching funds available to finance integrated data systems for the purposes of advancing interoperability and ultimately also to improve evaluation, boost evaluation capacity, better track, how programs are working to improve outcomes. And one resource that can provide a lot more detail on these funding strategies than I could in the brief time we have here is the National Academy of Public Administration, NAPA, about a year ago, published a field guide for financing integrated data systems and evaluation in the public sector. Happy to share that link to that resource, but there's a lot more detail around these funding strategies, including blending and braiding federal fund sources to support this.
That would be great. Yeah, absolutely. Appreciate that. We'll pass that along to our audience members. Let's talk a little bit about ROI that resonates. We talked about measures and outputs versus outcomes and things like that. We also talked about, kind of business drivers for interoperability. Funders want to see a return on the investment. We're seeing that much more now than ever, I think. But not all returns are super quantifiable or certainly not financial, right? We are not talking about private industry where you know, I think I read in the newspaper today, one very large organization is laying off, you know, 500,000 people because they are now using AI, right? We in Health and Human Services and certainly in public sector are not likely to see those sort of large scale FTEs in a state government agency where we already have major vacancies, workforce issues, things like that. How have you measured, I'll start with you, the return on that investment, especially when it's not a financial return? What do you say to compel those sort of investors to realize that that's a worthy investment?
Tough question, right? In part, I would say public sector budgets are also not super well oriented to do ROI calculations, especially when you have experience-based budgets that build year on year on year. The unit cost is largely lost, right? It's very hard to go back and say, to do 1 unit of information referral costs you this amount of money. It's really difficult to do that. One of the things that we got a partnership grant from OMB when I was in county, and we used our integrated data system as the basis for determining return on investment and social return. And we picked homelessness as the population, the service area that we were going to measure this, both in ROI and a social return on investment, trying to say that the use of an integrated interoperable system actually leads to X amount of savings and efficiency. It was both efficacy and it was both efficiency and cost effectiveness. We were measuring both. And interestingly, and we have some definitions around what was a return on investment and how to calculate the social return. In social, while an ROI was within a 12-month budget cycle, a social return was calculated over a 5-year period, sort of really giving time for recidivism and those kinds of things to have been factored in to make sure that if self-sufficiency was part of the goal, or if it was independence from, you know, having a job, holding a housing, those kinds of things. And we did it on a single adult who was homeless, and we did it on family. And what we found when we did that calculation was that this single adult, chronically homeless, medically vulnerable, we could really show the ROI, and we could show social return, because once they were housed with all the care management services that they got, that you could actually have success. With families, there was not a 12-month ROI, but in a 5-year time period, you could demonstrate that you were making gains, but there was a lot more outlay of resources to support that family, that whole family unit over that extended period of time. And it did affect our funding strategy, you know, and we decided that we were going to focus more initially on veteran, getting to functional zero on veteran homeless, single adult, chronically vulnerable homeless, you know, and families came as phase 2 of that entire investment strategy. So it does make a difference, you know, if you can show and the biggest win in interoperability is both the time saved on the front end, the reuse of data, but it's also the availability of cross-system data to be able to see a 360 view of the people that you're serving to make informed decisions. And I think that was super powerful from where I was sitting. And so can you make the social return case that spans more than an election cycle? That's always the question, you
Right.
know, in terms of making investments. And so you have to become really, I think, persuasive about how we do that.
Yeah, for sure. And reasonable, right? About setting
Always.
expectations about what can be achieved versus, you know, more of
Yeah,
those longer term things. Yeah.
for
Waldo,
sure.
have you had, you know, experiences where you've had to, you know, kind of design or define what those measurable ROI would be for, you know, supporting interoperable technology or systems of care?
Yeah, and you know, I'm smiling because every response I give is, well, as Uma said, following up on what Uma just said. No, and I, I won't belabor the point. She's absolutely right. It is, I mean, the only way that that we can really show ROI in this is not what the results of the episode of care is, but rather longitudinally, because these are, so in many cases, these populations are socially complex or have multiple needs. So you do need to have multiple inputs from social services, healthcare, from community organizations, but you need systems that measure longitudinally, right? So that not just case management systems, but people move out of one agency or one care provider or one Medicaid carrier to another, and the record gets fragmented and lost. So organizations that treat data longitudinally, for example, health data utilities or health information exchanges, community information exchanges, these are organizations that move beyond this the again siloed program system like an HMIS system or a health record, which is going to have a lot of really important information, but only part of the story, and are designed to interoperably aggregate that entire whole person record and maintain it, right? That keeping of the record up to date and the data quality is super important to to being able to use it to demonstrate ROI, and to be able to demonstrate that yes, it wasn't one episode of care that solved the problem. It actually had to go through 3 episodes of care. Right. But on the 4th and beyond, we saw, real gains. But you're not going to see those gains if you're just looking at one episode of care at a time.
Yeah. I just had like 10 use cases pop into my head. Kathryn, from, the national view, where you sit with NASBO, how do you view that, that ROI and how that's defined, or how states are doing that? Do you have some insights into that nationally?
Yeah, so I do think that the examples that Uma and Waldo gave are both really excellent to illustrate this point, and how return on investment of interoperability, while not purely financial, can really end up resulting in real cost savings, but is obviously more complex to measure. And I think what I would point to from my perspective, having worked on tracking state efforts to use data and evidence and advance the use of data and evidence in decision making. Going back to that topic of integrated data systems, they can both promote better service delivery and improve outcomes, but then also enable better tracking of those improvements. And there's a lot of good examples out there, at the state level, at the local level, of these integrated data systems and their power to yield real cost savings and better outcomes for residents. One example that comes to mind, I know Indiana's Management and Performance Hub, they I recall doing some work around really demonstrating the return on investment to the state of their system, their integrated data system, and what it enabled the state to do as far as efficiently and effectively allocating resources towards programs that were going to that were most effective at achieving statewide goals that were, key priorities at different points in time. So, and one organization that has done a lot of work around this, they have a whole network of integrated data systems, the Actionable Intelligence for Social Policy. They have a lot of work in this space that can point to more examples than just in Indiana of real research on that ROA question.
Excellent. Yeah, that we'd be grateful to share that with our audience as well today. We only have about 5 minutes left, and I don't see any questions have come in. So I'm just going to remind our audience that if you have any questions, you can drop those into the Q&A. The button is at the bottom of your screen. And in the meantime, I do see Mary Sarah has a question here. For most complicated value propositions like family use case that Uma shared, do you find that more straightforward value propositions or single year propositions can help prove the approach and help establish the foundation for more complex use cases, or do they not translate in that way? Uma?
Yeah, I just think a point in time or a 12-month is not enough to demonstrate what I'm calling an SROI as opposed to an ROI. And because it doesn't immediately translate to outcomes. And anything we do with very complex family situations or, where there are significant social determinants of health that are impacting outcomes, it's very hard to demonstrate outcomes in short term. It's also difficult to point to one thing that was the catalyst, because oftentimes when you are trying to work in a family context with multiple needs, whether it's, Waldo's case of a young mom with, with an infant, with substance use, with domestic violence, with housing crises, like what is it that's going to trigger that improvement? And sometimes you've got to put all those resources, you've got to figure out how to make the systems work together. Then you've got to stay with the family for a period of time, supporting them, teaching them sort of new coping mechanisms and skills of resiliency. And then you'll come out at the end and, as after an extended period of support, you'll start to see that situation turn. On the other hand, if it is, as simple, like if you said, if we provide food, if a child is coming to after school programming and gets a hot meal, does their homework improve in at the end of the semester or something? You can measure that in a very finite period of time. So I also think you have to see, what is the program? What are the resources? What's the outcome you're measuring? Sometimes the outputs are good to tell that story in the short term, but the outcomes may take a little longer. So that would be sort of the way I would try to answer that question.
Good point on the outputs. Thank you for sharing that. I did want to share with the audience too. Kathryn did drop 2 links in the chat there. So please do take note of those links, and we are nearly at time. It always goes so quickly. I have like 5 more questions I wanted to ask. So thanks for, it's a thoughtful discussion, right? Because we all know that there's some value in interoperability, if nothing else, for cost management of technology solutions, right? Or, certainly that no wrong door approach that Uma mentioned at the top of the hour, and looking to serve people across programs in a better way. There are a lot of business drivers, but often it falls down when it comes to funding. And so it will take some effort, especially now with the constrained budget environment that we're currently in. It's going to take collaboration. I think now is the time for public-private partnerships to really get more, solidified and committed to one another to take care of people in communities. But we had some key takeaways today that I hope you all were able to gain some value from this discussion, so that you can take your thoughts forward, whether you're a state government leader that's here today or a consultant who's out working in the field. We really think that now is the time, right? If not now, when? So thank you to Kathryn, Waldo, and Uma for sharing your expertise and your insights with us today. We greatly appreciate it. Jen, I think you have a slide to put up, or Debbie. We will continue next week and the week after this with our upcoming webinars in this series. So on November 13th, we have governance focused conversation. And then November 20th, we are going to have some real lessons learned from the field. And we've got some great panelists in all of these sessions. Again, these sessions are open to anyone. You do not need to be a HSITAG member to participate. Feel free to share your experience with others and invite them to join us in our remaining webinars. And we thank you for sharing part of your day today, and we hope you'll join us again in the future. And until then, have a great day.